I'm Dr. Urvashi Bhaya, your physical therapist. Welcome to my channel. If you haven't subscribed my channel yet, please go below. Press the subscribe button and the bell icon to never miss any updates. Today I'm going to talk about the most important topic, headache. So headache can be due to a lot of reasons, but the topic which I'm going to talk about is the cervicogenic headache. That is, if you have headache which comes from the neck area. So when you have neck pain, you can also have like pain on one side or both sides of the neck, and because of that muscle, that is the suboccipital muscle, it gets really tight, and that can radiate your pain up here and even up here. And you would have headache because of stress, or maybe a long day of stressful activities, or maybe staying in an awkward position for a long period of time because of an awkward posture. Well, if you have any of these causes which gives you headache, then these exercises are for you. So cervicogenic headache is not just the headache because of the neck pain. Obviously, the cause of it is improper posture. So the first and the most important thing is to correct your posture. So for correcting the posture, what you have to do is, so you always tend to sit like this, like a poke chin posture, forward head, and then rounded shoulders. So to help you correct that, there are only two things which you need to remember. Always make sure that your shoulders are back, squeezing the shoulder blades at the back, squeezing the shoulder blades together, and then bringing your chin back. So 1, 2, 3, and relax. Again, shoulders back, squeezing the shoulder blades, tuck your chin, 1, 2, 3, and relax. Okay, so we'll do that 15 repetitions. Tuck the chin, shoulders back, sit up tall and upright. 1, 2, 3, and relax. So we'll do that 15 repetitions. You can also do it multiple times during the day. When you feel that you're going subconsciously, you tend to go into that posture. So try to come out consciously out of that posture and try to do these exercises. Okay? And then when you have that incorrect posture, you tend to have some muscle tension. So how to reduce that tension? You have to stretch your muscles. So the most important stretch which you need to do for cervicogenic headache is the suboccipital muscle stretch. That is this one. Okay? So which is right behind here at the bottom. So how to stretch that muscle? So you tuck your chin like this, and then imagine there's a string right here pulling your head up. 1, 2, 3, and down. Again, tuck your chin, pull up. Once you get that position right, hold on for 30 seconds and relax. Okay? I'm going to show you from the side view as well. So again, tuck your chin, hold and pull it up. 1, 2, 3, like that. Hold it for 30 seconds and relax. Okay? You're going to feel the stretch right here. Also, the most important thing for the headache is try to release that muscle here. So for releasing that muscle, take these 3 fingers, put it right by the base of your skull, and try to release in this manner. Okay? You can try to release that nice and slow, gentle pressure. You don't want to do too much pressure as well. So nice and slow, gentle pressure. You can do that for 15 to 20 seconds, about 3 times, which will help you to release the tension in these muscles. Okay? So now the next important stretch is the upper trapezius stretch. So for that, use the hand. So if you're stretching your left side, you bring this hand right behind the back. If you're not able to bring this behind the back, you can put it right below your buttock as well. Keep your neck straight. Use the other hand. Try to bring your neck or the ear to the opposite shoulder, like this. Okay? You will hold this for 30 seconds and we'll do it for 3 times. Again, if you want to stretch your right side, you bring your right hand below the buttock, and keep your neck straight. Use the opposite hand. Bring the left ear to the left shoulder. Okay? Go to a point where you feel a good stretch and no pain. Okay? You'll feel the stretch in here. Hold it for 30 seconds, 3 repetitions. Now, the next one, whenever you have that poke chin posture, obviously your levator scapulae muscle, they get tight. And because of that, you gotta stretch that muscle to reduce the tension in that muscle. Again, you can, if you want to stretch your left side, you bring it behind the back, or you can put it behind below your buttock. Then rotate your neck to the opposite side. Use the other hand to bring your head to look towards the floor or your underarm. You look towards your underarm like this. Okay? Hold it for 30 seconds. We do it for 3 times. You'll feel the stretch here in this direction. You do it the same way for the opposite side as well. Okay? Hold it for 30 seconds and do it 3 times. Now, for cervicogenic headache, it's really important to strengthen your shoulder blade muscles. To strengthen your shoulder blade muscles, you can do these exercises in sitting position as well, but I would prefer laying down in prone position, that is on your belly, to help you relax your neck muscle so that you don't tense it too much, and then you can do it in laying down position. But for some reason, if you cannot lay on your face down position, then you can do them even in sitting position. But just make sure when you're sitting and doing those exercises, you want to relax the shoulder muscles. You don't want to tense them up, because if you're tensing and then you're doing the exercises, then you're basically not correcting your posture and you're just increasing the tension and not working towards the strengthening. Okay, so you can roll a towel like this, put it right here. You're going to keep your forehead on that. Okay, now relax your neck and shoulder muscles. Now bring your shoulders or arms at about 90-degree angle. Okay, and now squeeze those shoulder blades towards each other, and 1, 2, 3, and relax. Okay? Again, 1, 2, 3, and down. You can do that for about 15 repetitions, 3-second hold at the top. Okay? Now bring your shoulders about 120 degree, and when you're doing that, make sure you're again relaxing these muscles and just squeezing your shoulder blades towards the bottom, like towards downside, and squeezing them together. Okay, like this, in the shape of a Y. Again, 1, 2, 3, and down. 1, 2, 3, and down. We'll do that for 15 repetitions. Now, the third one is in the shape of an I. Again, you bring that about 150-degree angle and lift them up. 1, 2, 3, and down. Again. 1, 2, 3, and down. You'll do them for 3-second hold, 15 repetitions. Okay. Now you can lay on your back. And what you're going to do is, you're going to tuck your chin. You can bend your knees and lay down. You can tuck your chin. After tucking your chin, you can lift your neck up just a little and down. Okay? Tuck your chin. And make sure you're not lifting it like this, because if you're lifting it like that, then you're using your superficial muscles, and you don't want to use your superficial muscles. You want to use your deep flexor muscle, like these deep muscles inside. So that's why tuck your chin back, like down, and okay, tuck your chin, 1, 2, 3, and down. Okay, we'll do that for 15 repetitions. And now the next one is the most important one. When you're tucking your chin, we want to work in that upper cervical area. That because whenever you have the headache, it's actually because of the upper neck area where the tension builds up, and the problem is right there. When you are doing the any movement, the problem is right up there. So what you do is, when you tuck your chin, you just have to do a very small nodding motion, which is this, like tuck your chin and just nod. Again, tuck your chin. Okay. You can do that nodding motion by tucking your chin 15 repetitions. That will help you a lot. Okay. Now, the very last exercise is whenever you have upper cervical problem or upper neck area problem, you have limitation in rotation movement. That is, you're not able to rotate all the way. For example, if your right side is the problem, then you can use a towel like this. This is a big towel or a long towel. You can use the short one as well. And keep it at the base of the neck, okay? By keeping it at the base of the neck, and then you're gonna keep this down and then rotate all the way like this. If your right side is limited, okay? So keep it at the base of the skull, bring this one down, and then the opposite side rotates the neck and takes it sideways, okay? Make sure you're not covering the whole face and trying to do this. You just want to keep it at the base of the skull. Don't put too much pressure even on the ear as well. Just rotate your neck like this. Okay? You can do that for 15 repetitions. Even if you have left side problem, then you can hold on like the opposite side and do the opposite direction as well. You can do these exercises at least once a day. Remember, if you have any of these problems like sensitive to light or sound, or if you have nausea, vomiting, any of these symptoms, then you know that your headache is not because of the neck pain. Then you need to go and get it checked with the doctor. You can do these exercises, and these exercises would help you improve the posture. It will also help you in improving the strength in these muscles, basically your neck muscles and even the shoulder blade muscles. If these exercises increases the pain in your neck or your head, then please do not do these exercises. If you like my video, please like, share and subscribe. I hope these exercises helps you. Thank you.